Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Tim Houston, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Premier.
Thank you so much. Thanks for joining us, everyone. I want to start today by acknowledging the 4 Nova Scotians who lost their lives to COVID since we were last here. I can't express enough how upsetting it is that we're still losing people to this virus. It's even more upsetting when the cause of some of them is an outbreak that never should have happened. I also want to say, unfortunately, one of my colleagues has recently been diagnosed with COVID. I've spoken with Minister Masland. She's fully vaccinated. She's been being regularly tested and has done everything right. And I will say that when I spoke to her, she said that she couldn't imagine how she would be feeling right now if she wasn't fully vaccinated. She's not feeling very good. So she is, of course, working with public health on contact tracing, and we're wishing the minister a speedy recovery. COVID is not going away easily. We're seeing cases around the province, and we are seeing cases, of course, related to the faith-based gathering in the northern zone in late October, where it appears that many of the people who participated were not vaccinated. More concerning is that our hospitalization and ICU numbers have taken a jump, and of course, Nova Scotians have died as a result. So like many of you, I am absolutely appalled at the comments of some of those who were allegedly involved in organizing this gathering. The comments downplaying the seriousness of what's happening, the comments minimizing the loss of life are completely unacceptable and totally disgusting. Lives were lost. I can't imagine that at this stage in the pandemic, with the devastation we've seen to families and to communities, that we have people who believe that they can pick and choose which rules they follow. A fine has been issued in relation to this event. My understanding, it's the maximum fine possible. To me, it's not enough. We'll be looking at changes to the level of fines. The question that we've been struggling with is, are the cases that are coming from this event a result of a policy issue, or is this more of an enforcement issue? And in talking with Dr. Strang, we feel that it's primarily an enforcement and compliance issue. My gut tells me that whatever rules were in place, this particular group of people would have simply done what they wanted. So that means it's really down to enforcement and compliance. And I am concerned about the delays in enforcement in this matter. I don't understand what took so long, and I don't understand why only one person has been charged. So I can't stress enough. We're reviewing that, and certainly I'm asking a lot of questions. We will get to the bottom of the enforcement delays, and we'll fix it. We will do that, and we are in the process of asking those questions of the compliance team right now. But I can assure all Nova Scotians that the message has been sent loud and clear, that enforcement delays are not acceptable. This entire situation only confirms the need for those who work closely supporting others to be vaccinated. If anyone needed another reason to go and get it done, here it is. Sadly, 3 times over. So the time to act is now, before you're sick and before you put yourself and others at risk. So all of that said, I will say that I am encouraged by the latest update from the sectors impacted by the mandatory vaccine policy. We've heard from the majority of employers in these key sectors, and the vaccination rates are very good. Of the data reported, 94% of Nova Scotia Health Authority employees have at least 1 dose. 99% of IWK staff, 93% of long-term care staff, 89% of, and this will all be in the release, 89% of home care workers, and 97% of those in education, and 99% of workers in emergency health services. So those numbers are good, all things considered. We need to keep working to get them up a little higher, and we'll have an update next week on I guess a final update after the November 30th deadline. So my sincere thank you to all those employees who have been vaccinated and who made the choice, a choice that protects the health of the people that they care for at work every single day. And again, my sincere condolences to those impacted by the selfish acts of others. Dr. Strang.
Thank you, Premier, and good afternoon, everybody. I also want to extend my sympathies to the families and loved ones of the 4 Nova Scotians who died since our last briefing. As of today, we have 236 active cases of COVID-19 in the province. Nova Scotians need to be prepared to see ebbs and flows in the number of cases across the province in the weeks and months ahead. Unfortunately, from what we are now seeing in Canada and other countries, this 4th wave is likely to stretch well into the new year. That means we all need to be prepared to continue with current public health measures through the winter. We continue to see cases in all health zones and evidence of limited community spread in northern Nova Scotia and the HRM area. The cases in HRM are related to an ongoing but stable cluster in a defined population involving mainly children who are not yet able to be vaccinated. And we're also managing outbreaks in northern and western Nova Scotia health zones related to the faith-based gathering that occurred in late October. The outbreak in Western Zone has been contained to people who attended the gathering or were in the home faith communities of people who went to that gathering, and does not appear to have spread in any substantive way further within that zone. This is not the case in Northern Zone. We're seeing secondary transmission in workplaces, schools, a group home, and a long-term care facility. And most concerning are the deaths of 3 Nova Scotians, increased hospital admissions, and an outbreak at East Cumberland Lodge, all of which are linked back to this initial multi-day faith gathering. I am both angry and frustrated. People chose not to get vaccinated. They gathered with both vaccinated and unvaccinated people against existing rules, and these choices have had significant impacts upon others. I understand that no one intended for this to happen, but if we give COVID-19 a chance to spread, it will, and as we know, it can be deadly. To those who say that our proof of vaccination protocol and other public health measures infringe on your freedoms, I'd say that freedoms come with responsibilities. Your personal freedom has well-established ethical and legal boundaries when it creates significant risk to others. In a pandemic, we all must do whatever we can to protect ourselves and one another from this virus. And those responsibilities include getting vaccinated and following public health measures and protocols. Even with the low-level community transmission and a highly vaccinated population, the virus has made its way into a long-term care facility. Despite being fully vaccinated, the frail elderly are more susceptible to the virus. 31 residents and 10 staff have been infected, and 2 of the infected residents have died. That is why getting 3rd doses into long-term care residents, those who are immune compromised, and Nova Scotians over 70 is very important. A 3rd dose will give these groups either the same protection that most adults get from 2 doses or boost waning immunity. The impact on the East Coast Lodge long-term care home has been significant, but without vaccine, it would have been much, much worse. As I've said before, no vaccine or any other medical treatment for that matter is 100% effective. Some people will get infected with COVID-19 even though they are vaccinated. The reality is that as more people get vaccinated, we will see lower overall case counts, but a greater proportion of the remaining cases will be breakthrough cases. What we expect is that the vaccine greatly reduces the risk of severe illness, hospitalization, and death. When it comes to cases in unvaccinated versus vaccinated people, national and international research shows us that when compared to unvaccinated people, Fully vaccinated people are 80% less likely to be hospitalized and 66% less likely to die as a result of the virus. And within our own country, data from the federal government shows the stark contrast between those who are vaccinated and unvaccinated. The average rate of new COVID cases among unvaccinated people in Canada is 7 times higher, and the rate of COVID-19 hospitalization in Canada is 23 times higher for those who are unvaccinated. And among people 12 to 59 years of age, unvaccinated people are 45 times more likely to be hospitalized than those who are fully vaccinated. The data clearly shows that vaccines work. We cannot be complacent when it comes to COVID. The outbreaks we're seeing now are examples of how quickly the virus can spread and the impact it can have on both those who are unvaccinated and those who are vaccinated but more susceptible to the virus. I cannot stress this enough, and lives depend upon it. We must continue to follow public health measures to prevent the spread of COVID-19, including wearing masks in indoor public places, staying home when unwell, requiring proof of vaccination for discretionary gatherings, and most importantly, getting vaccinated against COVID-19. And I'm pleased to say that today, our official number, we have passed. We're at 80.6% of the total population, which means 90.6% of those who are eligible. You take away the kids who are under 12. Though, so we're at the first time we're at that level. Who had received 2 doses of vaccine, are considered fully vaccinated, and we have another 4 or 5% with 1 dose. And many of them are already booked to get their second dose. So for all those Nova Scotians, the vast majority of Nova Scotians who have answered the call and are getting vaccinated, a huge thank you. To those who could be vaccinated but aren't, who are focusing only on themselves, believing misinformation and false narratives, and more reacting with inappropriate anger, shame on you. You want to share in the benefits of Nova Scotia's strong COVID response, but you're not willing to carry your share of the work. Earlier this month, we adopted the National Advisory Committee on Immunization recommendation on booster doses. NACI has recommended that booster doses be administered 6 months after the final dose in the primary series. So today I'm happy to announce that starting November 23rd, you can schedule your booster dose 6 months after your primary series if you are 70 years of age or older, if you received 2 doses of AstraZeneca vaccine, if you're an adult frontline healthcare worker who received your first 2 doses, and there was less than 28 days between those 2 doses. So if you're in any of those groups, starting November 23rd, you will be eligible for a booster dose, and you can schedule that online or by phone. However, I need to emphasize, you can only schedule your booster dose once, first of all, if you fit into one of those eligible groups, and there has to be at least 6 months passed since you finished your primary series. So that, again, this means that on November 23rd, anyone who received their second dose as of June the 9th can schedule a booster dose. If you rescheduled your second dose before this, if you received your second dose after this date, you are not yet eligible, and you can't book in advance. You have to wait for the 6 months to pass. Booster doses will also be available soon in First Nations and African Nova Scotia communities across the province. Clinics will be are being organized in partnership with these communities and along with support from local public health members. And the booster doses continue to roll out in long-term care facilities across the province. And in addition to the residents, designated caregivers are also being included in the booster rollout if they received their second dose less than 28 days after their first dose of vaccine. So again, if they're in that group that had a very short interval between their 2 primary series. And again, for the caregivers, they has to be at least 6 months after they finish their primary series. Designated caregivers who meet those qualifications can also schedule a booster dose as of November 23rd, online or by phone. So in closing, I have a few requests for all Nova Scotians. If you're not vaccinated, it's not too late. Go get your first dose. If you're feeling unwell in any way, stay home and away from others and book a test. Go online or call the phone line and get an assessment to see about getting a test. Be careful and cautious around who you're around until you get that test result. And follow all the other public health protocols, wearing your masking, proof of vaccination. They are in place for a reason, and this week we've seen what can happen when they aren't followed. The holiday season is fast approaching, and that means gathering with family and friends. And the best gift you'll be able to give to them is a COVID-free holiday. And if you do all these things, you will have done everything possible to protect yourself and the people you care about. Thank you.
We'll now take questions from media in the room and on the phone, starting in the room. Go ahead.
Can you be specific about what you see to be the enforcement issue?
Well, the faith-based gathering was a couple weeks ago, and I'm not sure what the delay is in issuing the fines for that. So I just think that we need to be vigilant when somebody breaks the rules. The enforcement team should be there to find them.
The Amherst Police Department told me they were waiting on guidance from public health from the province. Why would they be looking to the province for guidance on how to conduct a police investigation?
There's no real answer for that. Law enforcement should do their job. They should enforce the laws. They don't need guidance from any elected official, any bureaucrat, anybody in the civil service. They should enforce the laws that are on the books. They should just do it without delay.
I've had multiple meetings with chiefs of police with the Department of Justice and made that very point. Every time we make major changes, they're made clear to them, and we've had conversations about the expectation and the role they play on an enforcement.
And Dr. Strang, a couple of weeks ago when we first heard you talk about this church event, you said that you didn't think punitive action was the right response. What has changed since then?
Well, that was at the very beginning of this, and we're all in the very beginning. We're in the process of establishing a constructive working relationship with the number of faith organizations that were involved, and getting the necessary information and supporting people around testing. But as time has gone on, we've learned more. Clearly, we're seeing impacts from the non-compliance, and quite frankly, remarks made yesterday which were entirely outrageous, push people into a corner, and that we need to take stronger enforcement action.
I wonder about the initial alerts on this, and the fact that we try to balance stigma against public safety. Clearly, in this case, it appears not to have worked, because there was no alert that went out about this meeting, and that this meeting had posed a problem, and we're in the situation we're in. I'm wondering if you have any thoughts on that. Should we reconsider that?
Reconsider in the sense of?
If there's an event involving a situation where there's been an identified problem in relation to COVID, that people should be told about the event in terms of, this is the event, this is when it happened, this is what you should be aware of.
I think, go ahead if you want.
So we do that all the time. That's why we have all the exposure notifications. We only use those when there's been some kind of circumstances where we can't in other ways contact people who were at an event, at a setting, and were exposed. In this circumstance, we knew who was at that event. We knew the faith organizations that were involved, and we were able to reach out and communicate in other ways without having to do a public notification.
Were you able to go to the home and tell them that perhaps there might be somebody who works there who might have been exposed to this event?
At the time, at the initial beginning of that, we had no indication that there was an individual that we would go to that was employed in that facility.
But that goes to my point. If you don't say publicly that there was this meeting sponsored by this Baptist church in the Amherst area on these dates, there's no alert that goes out to anybody. Perhaps somebody at the home knew that somebody went to that and could have taken steps.
Well, everybody who was at that event was then contacted directly or indirectly and said, you've been in contact, here's the steps you need to take in terms of testing, isolation.
But isn't that a bit of the cart after the horse?
the cart was after the horse as soon as they had that event in contravention of the rules. I think public health did what they could in the early stages as they kind of tried to find information, but clearly look at the information that's come out since, including the comments from the pastor over the last couple of days. So I think this is a situation we're probably going to learn a little bit from this one, to be honest. I'm personally right now focused on the enforcement side. My personal hope is that a lot more people are fined
The
from
problem
this.
with the lack of information, because on this side of the fence, we certainly do. That's why we ask these questions to begin with. First question we asked, where did it happen? We didn't know. No one knew. And then all of a sudden we're getting told about a spread and then eventually deaths as a result of this. Does that make anybody
Look,
think about, we got to do something a little bit different here?
well, there's a lot of public notices of exposure sites. Will we continue to look at how we determine whether a public notice should go out? Of course, we'll continue to look at that and make decisions on that. But if you look at other outbreaks in different communities, they were able to contain them, because there was a lot more cooperation maybe with public health. So look, every decision that Dr. Strang makes, that public health make, that I make, is all in the interest of keeping people safe. If we can make better decisions based on more information, we'll make better decisions based on more information. But as we learn more, I think what you've seen is we've done more.
I just want to add one more thing, because I hear what you're saying, and we're certainly going to look at that, but also we got to understand that it's not that you should ignore COVID until you're notified that there might be COVID. We've got COVID all around us. That's why every day we need everybody to be thinking about, what do I need to do? Long-term care facilities have protocols in place about their staff, their visitors, that are followed every day. So a notification of a possible exposure should be layered onto all these other things.
Yeah, but I guess that sort of goes to the point then, why bother telling someone that there was a potential exposure at a Walmart if all those people should have been following your safety guidelines anyway? Do you see what I mean?
There's an additional recommendation for those people for if you're potentially exposed around potentially testing. But our approach is always, if we can reach the people that we need to reach, who we judge are being identified as close contacts and need to be doing more beyond the measures all of us are doing, we use those that's the purpose of public health communication. We use those.
To answer your question, we don't know who went into Walmart.
Right.
But we know who was at this event.
So
And
the
so when
reason
you
you
know,
knew all 100 people, you knew, and everyone they had come into contact with, and everyone they had come into contact with. I mean, you're the ones who've been telling us how quickly the virus can spread. It just seems like there's a bit of a double standard. In this
I
particular
don't agree
case.
that there's a double standard. I think that the public health instructions are clearly communicated to people. We hope and expect that people follow them. But we have some people in our society that don't. And I think that what we're seeing is the result of that right now in this particular case. But look, I don't want to be dismissive of the questions. We'll look at how we communicate going forward for sure.
Besides this particular outbreak, two of the other recent outbreaks were around faith communities as well. Is there a concern that our policies around faith communities isn't strong enough?
Well, I'll let Dr. Strang come in, but this has been the topic of discussion. I think what we've seen to date is the regular services. The epidemiology doesn't suggest that there's issues with the regular services. Anything outside of the regular service is meant to follow the public health rules. So, if finance committee meets on Thursday night at the church, it's supposed to follow the rules, right? And this was a gathering where the rules should have been known to these people and would have been known. I would submit that's my opinion. They decided not to follow them. So, the regular services themselves. We haven't seen issue with them, but it's an ongoing discussion. Dr. Strang, you may want to add to that.
So if you look at the epidemiology, we had this event we're talking about, clearly non-compliance, and that spread to a number of other churches who there were spread within those churches. The major issue there was that they had they don't believe in vaccination by and large, and very low vaccination rate. We've had one other intervention. The ongoing spread in HRM involves, it's complex. It's not just the faith community. It's more complex. But if you look at, I don't know what the number would be, that every week how many regular services, either at churches, synagogues, mosques, temples. We are not seeing those regular services as any significant drivers of transmission of the virus. The vast majority of faith organizations are working really hard to follow the public health rules. There's been some outliers. We need to deal with the outliers, not paint everybody in the faith community with the same brush, because the epidemiology does not justify that taking a broad brush approach to this.
Yeah,
You said the vaccination rate is very
just
low.
on that, I mean, that's why we're talking, is it policy or is it enforcement? Whatever policy we would have had in place, I suspect this group wouldn't have followed them.
The pastor,
What is
the
the
pastor
vaccination rate?
insists that he believed he didn't have to as a faith organization. So are you saying that he's not telling the truth?
Well, look, I don't want to speak to what he said, but I personally believe the rules were well known in the faith-based communities and across Nova Scotia.
I've met many times with the faith leaders. I've got an email distribution list of well over 100 people, and they were. I have the email thread that showed clearly I communicated what to the faith leaders that I'm able to communicate with. There are some faith organizations that are very independent and quite frankly, are very hard to communicate to. But we did everything we could to make sure the rules were very clear. And it was very clear this type of multi-day retreat absolutely required proof of vaccination to be applied, and it wasn't done.
It was either you or your deputy who told us in the last couple of weeks that that community had a 70% vaccination rate. You just said a moment ago the vaccination rate was very low. Is it lower than 70%?
I don't know. I don't know the numbers. It must have been Dr. Deeks. But certainly, what I do know is that there's a number of faith organizations in western and northern Nova Scotia who are at this retreat, and they've gone back, and by reports from the public health team, that the majority of people in those organizations, the majority of cases that we're seeing were people who could be vaccinated based on age but weren't.
Dr. Strang, I want to ask you about hospitalizations. The numbers have increased significantly in the last few days. Can you explain what's going on there, and are any of those people hospitalized children? And lastly, the number reported is for people with active cases. I'm wondering how much the hospital system is being impacted by hospitalizations by people who are no longer considered contagious, and are you starting to worry about capacity?
So a lot of questions in there. So first of all, certainly we've had some increase in hospitalizations, not unexpected, because when you see a surge of cases, it can often be a couple of weeks before you see the surge of hospitalizations, because it takes people it's later on in their disease before they get severely ill. What we've seen is created a little bit of pressure in the capacity in Western Zone, but certainly we look on a daily basis is what is the number of medical beds and ICU beds for COVID patients, and what we have right now is well within the capacity within the province. And I'm not aware of any children being hospitalized. So that as I said earlier in my remarks. We watch the daily case counts, but I'm much more focused on what is the trend that we're seeing in cases, and then where are we at in terms of COVID cases, and how does that match up within capacity within our hospital system? And fortunately, we are still well within that capacity. It doesn't mean there may not be some local pressures, because some of our the Yarmouth Hospital, I think, only has a couple of ICU beds, and both of them have people with COVID in them right now. But if we needed to, we have lots of room to transfer people.
You opened the briefing saying that the fourth wave would go into the new year. Does that factor in the concerns around hospitalizations and capacity?
Well, I think I'm always concerned. So that's as I said, that's one of the things the key things we're looking at on a daily, weekly basis is what are the trends that we're seeing in terms of cases, the number of cases, how those cases are occurring, what are the transmission patterns, and then what's the level of severe disease. So when we look at HRM, we're fortunate that a large majority of the cases we're seeing in HRM are kids who have a much lower risk of severe disease, and we have no kids in hospital. Doesn't mean we were complacent about COVID, because if you're complacent, then it spreads broadly. But I've said many times, we can expect and we can tolerate a certain level of spread of COVID, and that's inevitable. But we need to protect against that, and then one of the key reasons we need to protect against it is that if you don't, you overwhelm your hospital system, like we've got lots of examples in other Canadian provinces. We are in a fortunate position that we haven't even come close to that yet, and one of the key priorities is for us to never get there.
Can you give us an indication of how many people are in hospital who had COVID but are still suffering, but are no longer considered active cases?
I don't have that breakdown in front of me. There may be some people, especially in the ICU, who are there for prolonged stays, but I can't. I know the overall case number, but I can't give you that broken down right now between early in their admission and still, prolonged stays in hospital.
We're going to move to the phones, and we'll come back to the room before we have to end. Okay? So moving to Radio-Canada, Adrien Blanc.
Thank you. I wonder what is done to prevent further spread, especially in the north of the province, like increased testing or rapid testing or asymptomatic testing or mobile testing. Thank you.
So we've had, as I've said here, our testing strategy in the fourth wave is to not have asymptomatic testing for everybody, but we still have symptomatic testing. We have workplace testing in over 1,000 workplaces across the province. I think over 200 of those are in the northern zone, and that is asymptomatic testing. It's a surveillance system. And then when we do see signs of early spread in a community, then we move in, increasing asymptomatic testing in our primary assessment centers, moving in our mobile vans, working with our partners like Praxis who do asymptomatic testing, all of which we've done in the last few weeks in Amherst and other parts of northern Nova Scotia. Along with that, we're bringing in vaccine, and our mobile testing, we're also giving out take-home testing kits as well. And we have the school-based testing program of testing kits being sent. So we have multiple streams of testing, which we ramp up in any communities to increase access to testing, and that has happened and will continue to happen in northern Nova Scotia. The mobile units are going back up to Amherst yet again this weekend to increase access to testing. And I will say that we have lots of capacity in those mobile units. We haven't even come close to maximizing the daily testing volume that we could do in northern Nova Scotia. So you've got lots of opportunity, though, folks in northern Nova Scotia, that potentially is not being taken advantage of. We have way more capacity sitting in those mobile vans this weekend, so come out and use it, please.
Adrian, do you have a follow-up?
Yes, I would like to know if right now, if somebody haven't had their first or second dose, they can have it immediately or they need to wait. I have mixed information, and I talk about the northern zone especially.
No, our priority still in our vaccination program, even though we're talking a lot about boosters and additional doses, our priority remains and will always remains people who want to start their primary series. And all they need to do is go online and book an appointment through our online booking system. And they will get them, as soon as you book your appointment, we'll get you in there.
Moving on, we'll go to the Laker. Pat Healy. Go ahead, Pat.
Hi. This question's for Dr. Strang. What can you tell us about the current exposures at Hansey's-Royal High? Do we know how it got into the school? Their emails home from the school suggest transmission. Do we know if that is the case?
So it hasn't been brought to my attention in schools. They always start out with exposure. Somebody was exposed somewhere else in the community, and either staff or student, and they're then infectious when they're in the school. I think there's a very low number of cases. I think it's 3 in that high school. It hasn't been brought to my attention that there's any indication of transmission within the school at this point in time.
Do you have a follow-up, Pat?
Yes, I do. Is there any talk of opening up the testing site again in Emsdale with these cases at Hansey's?
Well, I think local public health will always look at the epidemiology and where we might see indications of increasing spread in a community, and then mobilize our resources to do that. So I think it's I'm not involved in those kind of detailed decisions, but I'm confident that if local public health looks at a situation and there is a need for increased testing in that community, that will happen.
Moving on, we'll go to Truro News. Chelsea Gould.
Hello to you both. What is your response to Liberal leader Ian Rankin's call for proof of vaccination at all faith services, including regular?
Well, I've got, I gave the epidemiologic explanation on that. Why it just not, for me, everything comes back to what's the science, what is the epidemiologic rationale, and I don't feel that there's any solid epidemiologic reason for that at this point in time. If it becomes that way, I'll be the first one to bring that recommendation to Premier Houston.
Chelsea, do you have a follow-up?
Yes, thank you. Would you consider making any requirements for non-regular faith events to be perhaps registered so the province is at least aware of them when they're happening to help with enforcement?
I mean, I think I continue to work with faith leaders, and as in the vast majority are doing really hard work and making some difficult decisions around applying all the public health regulations and following the rules, and their focus is, when I talk to them, they're well aware, and their focus is like mine, keeping people safe, keeping their congregations, their members safe. I'm going to continue to have conversations with those faith leaders. Some of them have reached out to me and said, what do we need to do? We don't want to have the proof of vaccination, so what more could we potentially do to keep our faith services safe? So I'm going to continue to engage in those conversations with the faith leaders and have working together. So I don't think something like creating a list is necessary. That the vast majority have, we're all on the same page, and it's about keeping Nova Scotians safe.
Yeah, and just on that, I think at any given time, there's lots of events and gatherings happening across the province, around the province, and they follow the rules. So everyone should follow the rules.
Moving on, we'll go to CBC's Preston Mulligan.
Yeah, question for the Premier. Premier, I gather that you've watched Pastor Smith's sermons, and I just wonder what your thoughts are, whether you think a fine of $2,422 is sufficient, given the kind of defiant tone he took in those sermons, and the spread that's allegedly connected to those services.
I do not think the fine is sufficient, and we're looking at ways to change the fines going forward. We're also looking at ways, I've asked the compliance team to look at looking at maybe if other people should be fined as well, other leaders that were part of the gathering, and if there's more times to apply the fine. Could it be one per day or something? So I would say I'm not, I don't believe the fine is sufficient, and I think the tone that was taken subsequent to then and is just really disgusting.
Preston, do you have a follow-up?
Yeah, I'm just curious whether you have personally been able to reach the pastor since viewing his sermon.
I have not.
Moving on, we'll check in with Linda Panozzo. Linda, are you there? Linda? We'll return to the room for a few final questions, noting we have a hard stop at 1:45. Go ahead.
With the Cumberland East Lodge in Pugwash, do you know if we're still seeing unvaccinated workers working in that long-term care facility?
I'm not. We're still working, like everywhere, on the vaccination policy. People have until November 30th to get vaccinated or show their intention to be vaccinated. That facility would be the same as anywhere else.
So we're not going to put it on any priority list to get booster shots, for example.
Well, we're not talking about booster shots. What we're talking about on our healthcare worker policy is people have until November 30th to get as a healthcare worker to get vaccinated. If they're not by November 30th, then they're on on unpaid leave.
Some people with that faith gathering insist that the person who was in attendance and was exposed, who then went to East Cumberland, was fully vaccinated and called 811, and 811 told her she could still go to work. Because on the chart, it just says, you know, if you're vaccinated, had an exposure, just get a test and you don't have to isolate. So is that something you need to look at, or has that been confirmed that that's what happened?
I don't know the details on that, but certainly our protocol is, and I've asked people to look at this, is that because of the low risk, it's not zero. I mean, this is all about, you know, that people who are fully vaccinated, if they've been in an exposure, they don't need to isolate, but we still recommend them to be tested. Remembering that there's also, even if somebody working in a healthcare facility, it's not just about vaccination. There's all the, you know, masking and other personal protective equipment, infection control steps that are in place to also protect. It's unfortunate that we've had this circumstance, but again, it shows why, in general, we need to keep levels of virus low and minimize the chance of even you are going to get breakthrough cases, but minimize the chance of of a vaccinated person and having another event like this.
But should maybe healthcare workers have to self-isolate if they've been exposed, even if they're fully vaccinated, just in case?
There are increased requirements for healthcare workers, whether in hospitals or long-term care facilities. I don't have all the details in front of me about this specific case.
The fine was levied by the Department of Environment and not by the Amherst Police. Was this an action of the provincial government taking action where they failed to see that the local police did not take action?
Yeah, I can't understand honestly why the police haven't advanced their investigation or taken up on that file. But yeah, to answer your question, yes, the compliance and enforcement group of Department of Environment is kind of a backstop to the police. The police should be doing their job. They should be enforcing the laws.
Your direction or Dr. Strang's direction, or how did that decision come about?
Yeah, I think that given the cases, given the situation that was there, that the compliance team started an investigation. I will say that I certainly put a lot of pressure on them to make sure that investigation happened.
Is there something that any action you're going to take or the Department of Justice will take in regards to the Amherst Police Department's non-action?
Not specifically right now. I mean, I don't have enough information on that, and it's the separation of you know, with the judicial system is for a reason as well. Personally, I have a lot of questions as to why it might not have, but that's not for me. That's for them.
Dr.
Premier,
Strang,
why
do we have
is
any
it
numbers?
Pastor as an individual who was fined and not the organization, which could have incurred a much heftier fine than an individual?
That part of the investigation is still ongoing as to whether this is kind of an official organization. So we just don't have enough information, but believe me, if we can, we will. There'll be more fines if possible.
I was wondering if we have any numbers yet to accompany the percentages so that we have an idea of how many workers actually need to get vaccinated.
So you were in the release and the Premier's remarks, you know, of the people reported, and most there's a high percentage of reporting. We don't yet have. We'll have that more as we get to November 30th. Specific numbers of, well, how many people are going to be expected to be, you know, having to go off on leave. We still have a couple of weeks, and I know the healthcare organizations are still working to try to get those people to start their vaccine series.
Premier, there is a business person in downtown Halifax that's being harassed on a regular basis by protesters. Does that fit in with your frustrations? Police were there in force, did nothing about it, and quibbled with the business person about where his sidewalk started and where his patio did. Does that fit in with your frustrations with how law enforcement is dealing with that kind of situation?
It fits in with the frustration of the general attitude of those who don't want to get vaccinated. I mean, we've heard about these roving protests outside a number of businesses. It's completely disappointing. I mean, these people are just trying to make a living and run a business. They're just following the laws that we make. So I really don't have. I do have the word that I'd like to use, but I can't use it in this form.
We'll take one final question. We'll take one final question in the room.
Did the Burton Ettinger Elementary School open up as planned today?
That's my understanding from yesterday. I was that it was planned to open today. I haven't heard anything differently.
Nothing further on that.
You'd have to check with education, but I get high-level updates, and my understanding from my team was that it was due to open up today.
That's all the time we have for questions today.
There you go. Okay. Thank you. So thank you for the questions. Dr. Strang has told us that the fourth wave will likely last a little longer than certainly anyone expected or wanted, but it's clear that COVID isn't going anywhere anytime soon, and that's bad news. But the good news is that it's pretty easy to give yourself the best chance against this virus. You just need to get the vaccine. So whether you're eligible for your first, second, or booster shot, just book your appointment and get it done. As I said earlier, the time to act is now, before it's too late, and before you get sick and before you make someone else sick. So thank you for joining us today.